The information provided in this podcast is for educational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Welcome to You Represent Science. I'm Dr. Deb Newitz, a patient advocate and someone who spent years inside a system I eventually lost trust in. Those doubts led me here. Anthony Fauci once told his critics, "I represent science." That claim that one person could own science is exactly what this show calls into question. Patients represent science, their experiences, their stories, their outcomes. So I call this show You Represent Science because you do. So I'm going to highlight the most important basics, which are usually undervalued traditionally. So a lot of people these days want a quick fix. They want medications for blood pressure, medications for weight loss, but it can't replace good nutrition and good exercise. So I want to talk about all the things that I've traditionally quizzed my children on growing up. So the first topic that I've always emphasized with my children is basic nutrition. So the most important thing is eating fruits, vegetables, fish, and nuts. Fruits are the basic source of carbohydrates. Vegetables have carbohydrates and healthy fats, and nuts are healthy fats, and fish is a good source of protein. So it's very important to have what I said was traditionally the zone diet, equal parts protein, fats, and carbohydrates. It's really important also portion control. So even if you eat healthy foods, you shouldn't eat them all day long, and that will promote like excess weight gain. So I always tell patients, try to have 3 plates of food a day. If you're concerned about your memory, the best food sources to promote memory health are honey and cereals. There's one subset of patients who actually did worse when they were eating cereals, and I don't think they did a follow-up study. So if you experience worsening memory loss with cereals, you should be considered for celiac. And one of the things that I've mentioned with celiac, I do think the blood testing is better than the endoscopy, which is an invasive, expensive study. So try to get the blood work. It's also additionally important to get all 3 types of blood work for celiac. So the TTG, which is tissue transglutaminase IgA, anti-endomysial, and anti-gliadin. So for example, my brother-in-law recently said to me, I don't have celiac, but I looked at his blood work results and he had only one of the blood tests. So it's very important to get all 3 of the blood tests. And I will also talk at a later time about, I've had so many patients and friends who I recommend all these tests are done, and then they go to the doctor who refuses to do them. I looked at Quest, and you actually can get a lot of these blood tests on your own. So that's really important that you can take ownership in pursuing what is causing your ailments and issues. But I noticed at Quest that you can only get one type of blood test, which is the TTG. So you'll have to, recommend to your doctor to get the other 2 blood tests. The worst things to eat are, in this order, potatoes, rice, bread, sweets, and pasta. Potatoes are the number 1 cause of diabetes and weight gain can lead to heart disease and cancers. Rice has arsenic in it, so if you suffer from arsenic poisoning, that's really not good, and that can also cause weight gain, diabetes, and heart disease. Breads, pastas, and sweets usually are very unhealthy by the mechanism of causing weight gain, which can lead to heart disease, cancers, also autoimmune diseases. Sugars also are exceedingly bad because they promote weight gain, which can lead to liver disease, cancers, autoimmune disorders, heart disease, and diabetes. So these diets, I have to say, are linked to better or worse outcomes, but we can't assess causation because everything has so many factorials, such as like genetics and other medications and other outside causes. So I'd almost rather you eat sugary foods, if you're going to choose, than the artificial sweeteners, such as like the low fat, low sugar diets, because you're replacing them with artificial chemicals that actually cause more cancer. So anything that's labeled low sugar, low fat, I would actually avoid those products. I'd rather you have soda than like the 0-calorie sodas and stuff like that. Those are always like replaced with chemicals and worse. But sodas actually are really horrible. I always forget to like tell people, you could do it once in a while. Like, so it's so funny. So all my patients always say to me, so I can't have any potatoes, rice, bread. And I'm like, no, I mean, I'm not going to go into your house and reinforce these. It's just do better. Like I used to have potato chips every weekend, and now I have potato chips like once every 6 months or so. So the point is, nobody's perfect, and I'm not going into your house and enforcing these rules, but you just try to do better is what I always tell people. And that's also in terms of exercise. So a lot of people count their steps. I don't even know what these steps mean. So try to exercise 30 minutes a day and try to get your heart rate greater than 150. Now, obviously, if you haven't exercised in a long period of time, this is going to be difficult. So that's why I say try to do better. Try to get the heart rate greater than 150. So a lot of people say they do all these steps, and I don't know how beneficial that is. I think the better thing is getting the heart rate up. So I haven't historically worked out a lot. And I look around the room, so I go to Orange Theory. And because I haven't worked out a lot, I am the person in the room that has my heart rate greater than 150 the most. And so that's a good thing for me, but it doesn't necessarily measure a better outcome for everybody else, just because they're probably in better shape. So it's more difficult for them to get their heart rate up. So that's why I'm trying to say, attempt it, push yourself. And you're always trying to like fight your own demons. And the most important competition is against yourself. You're bettering yourself. So I always tell my patients and friends that if you don't have a heart rate monitor, the whole point is you really want to get your respiratory rate up. So you want to be breathing hard. It should be a little bit difficult. The whole point of exercise is just pushing yourself more and more. So we're going to start talking about everybody's favorite or less favorite subject, alcohol. Alcohol, people don't realize 7 drinks or more can really be a huge liability against your health. People who go out and drink either a drink every day or even 7 drinks on the weekend can have really horrible outcomes. So I one time had a patient come to see me to be evaluated for seizures, and he was a young guy in his 20s. And there was something that I knew, like bells went off. And I said, are you drinking at all? And he said, yeah, socially. And I said, how many drinks? And he said, just on the weekends. And I said, how many about? And he said, about 20. And I said, do you tend to have these seizures like a certain day of the week? And he said, on Mondays. And I said, well, you're having withdrawal seizures. So the thing that you can see with alcohol, whether it's in huge consumption in one day or just a drink every day, I've seen breast cancers, I've seen heart disease. And so really cutting the alcohol down to below 6 drinks a week or even less really can improve your health significantly. My father, who's 92, used to have a drink every single day. And I really got him to cut down to maybe like 2 drinks a week. And he is now exercising better, and he says he feels better than he has in years. His blood pressure is better. I had a patient, it was interesting. She was an oncologist who specialized in breast cancer, and she walked into the room, said she was in a lot of stress and was having a drink a day. And I knew, just deep down, I just knew it. And I examined her, and she ended up having a lump, and she ended up having breast cancer. So people think that just having a drink a day is not an issue, but it really can worsen your heart disease and your other medical problems, such as putting you at risk for cancers. Each type of alcohol is different by volume. So if you have a bunch of guys getting together to watch a football game, just remember that 1 can of beer equals about 5 ounces of a glass of wine, which equals a shot of whiskey or hard alcohol. So it's difficult to equate what level of alcohol will be bad for you. Try to keep it as low as possible because it can cause, and I've seen, arthritis, seizures, and cancer. So you just really want to do the best you can because I've seen so many people get better just by reducing their alcohol intake. So other substances, people frequently ask me, what do I think about legalizing marijuana, weed, etc., whatever you call it? It's really bad for you. And a lot of things are legal or illegal that are bad for you. And so what I really tell people is it's sort of not, it doesn't matter. It's irrelevant. And people forget that prior to COVID, there were a lot of kids vaping and ending up dead or in the hospital. So it really is associated with memory loss, lung disease, heart disease. Infertility these days is a big issue, arthritis, psychiatric disease. We hear a lot of like schizophrenia associated with drug use. So just really avoiding any of these, whatever you call it, weed, marijuana, pot, I don't know. But it doesn't really matter whether it's legal or illegal, it's bad for you. So just stop. I think the thing that I worry about, I think Alzheimer's is overdiagnosed. And so I think it's really more a problem of memory loss. And I think I've touched on this before at a previous podcast, is memory loss is so under-evaluated. So you really have to check thyroid levels, celiac, B12 for cancer. I've seen a lot of patients with cancer who present with memory loss. To say there are studies that nicotine show resolution of Alzheimer's, we don't know what else it's treating. And I think there are probably other solutions to treating memory loss. So I don't like to equate memory loss with Alzheimer's because I think memory loss is a bigger problem than Alzheimer's, which can only be diagnosed by brain biopsy. So I understand that there are studies being currently done on nicotine showing that there are some positive benefits to it. But in general, nicotine, whether it's ingested orally or respiratory, it really does have bad outcomes and causing like lung disease, heart disease, which are bigger problems, and cancers. So avoiding these products is really important. Now we're going to talk about creatine and caffeine. So in excess, caffeine should only be consumed about 2 cups a day at the most. Otherwise, it can cause like arrhythmias and kidney stones. Creatine is really bad. And I know everybody takes it in their supplements and pre-workouts or whatever. It's really bad. It causes kidney failure. And so I would really completely avoid this product. Recently, one of my family members had high blood pressure and early kidney disease, and they were only taking these pre-energy workout drinks that contained creatine and caffeine in excess. And we stopped it, and the blood pressure went away, and the kidney issues went away. So it's really important to see that even though you look good, like I've seen over the years, people are really into physical fitness and health, and they are taking creatine or excessive caffeine pills. And even though you look healthy, you're not healthy. Speaking of blood pressure, the systolic blood pressure, the top, and the diastolic, the bottom, are equally important. So a lot of people say, oh, it was just the top blood pressure or the bottom blood pressure. They're equally important. So anything below 130 on the top, systolic, or 80 on the bottom, diastolic, below that is normal. 130 over 80 or above is abnormal and should be evaluated and treated pretty quickly. You want to make sure that you don't have evidence of organ damage from this, such as like heart disease and kidney disease, because then that means you really should be quickly treating these things. And I find that everybody's become very lax about treating blood pressure. And over the years, I've had patients recurrently go into the hospital with strokes and heart disease, and all I do is control their blood pressure and the problems go away and they're not in the hospital anymore. One thing that I'd like to mention is I know there's like a split between traditional medicine and more holistic, non-traditional medicine. And I do think that both forms should be equally recognized. But I do think there is a lot of value, and I've seen it, time and time again with blood pressure control, cholesterol control through medications. So there is room for addressing alternative medicine, but there is a tremendous value in traditional medicine that should not be rejected. Our next topic will be on antibiotic resistance. So, for example, there's an organism called E. coli. In the hospital, there's 65% resistance to an antibiotic, ciprofloxacin. And in contrast, in an outpatient office setting, there's only 15% resistance to ciprofloxacin. So one of the big causes of death and morbidity, mortality is underuse of antibiotics. So you hear in the news all the time, somebody died of pneumonia, somebody died of strep throat. These are all examples where antibiotics were underused. So antibiotics are underused in the outpatient office setting. And once you've gone into the hospital and you're actually more prone to resistance. So I actually go against the grain and recommend more antibiotic use in the outpatient setting out of the hospital, as opposed to once you get into the hospital, it's too late. I recently met with one of the parents whose child died from reported measles, and that child actually did not die from measles. They were inappropriately treated with antibiotics. It was given too short term in the hospital, and that resulted in antibiotic resistant organism that unfortunately made the child die. Imagine you wake up one morning and you have fevers, headaches, sore throat, and your whole body hurts. So of course you would diagnose the flu. Unfortunately, the flu doesn't always present the way you want it to, or classically. I've seen patients with just chest pain, just trouble breathing, just vomiting, and they do have the flu. So unfortunately, we don't realize that influenza can be extremely dangerous. In fact, in 2025, 27,000 people died from influenza. That to me is a catastrophe. It's completely treatable. And the only problem is the influenza vaccine is 32% effective. Or you want to turn it around and say it's 68% ineffective. The other thing is the flu, one of its diagnostics tests, the rapid antigen test, can be as poor as 50%. So to rely on a test that half the time can be wrong is also, to me, so sad. And I really have encouraged all my patients, and I use oseltamivir and Tamiflu very frequently. There's a lot of studies done that it's anti-inflammatory and antiviral. I have actually used it in COVID infections, and I only had one patient hospitalized that failed Tamiflu. So it's, to me, the medicine Tamiflu or oseltamivir is so infrequently used and underutilized, and to preventing poor outcomes, death, prolonged morbidity. I've seen people sick with the flu for a month, and once I give them oseltamivir or Tamiflu, and they're better the next day. I had a patient who had a negative flu test, and all she had was vomiting, and we gave her a Tamiflu, and the next day she was better. I've had several patients who were admitted with chest pain, and they were undergoing extensive and very expensive cardiac workups. And I knew they had a history of no heart disease, and I gave them Tamiflu, and the next day they were better. So this is a medication that for some reason people really stay away from, and it's had a bad name, and it's really unjust and very unfortunate and should be used more. I did actually also have a patient who was admitted to the hospital and had a positive flu test, but because she had had more than 48 hours of symptoms and they didn't give her Tamiflu and she died. And to me, that is a tragedy. There have been some black label warnings on oseltamivir causing depression in children. In that case, if you have any concerns in giving your child oseltamivir, you can give the 1 dose of Fluzа. The next case is really common. You have fever, you have fatigue. That could be almost anything. Then you progress to having chest pain, rash, muscle aches, joint pain. What do you think the diagnosis is? In this case, it's Lyme disease. The problem with the Lyme's test is we're doing initially what's recommended, which is the ELISA. It's only 35% sensitive, which is actually 65% insensitive. So we're relying on a test that most of the time doesn't detect your disease. Then if that test is positive for a confirmation, you proceed to the Western blot, which is 95% specific. When I say 95% specific, that means that 95% of the time, it is specific for diagnosing that disease. So the ELISA test is a test that measures your antibodies to the disease, which is really variable. The Western blot actually measures your antibody response, your immune response to the proteins on the Lyme infection. So it's a better test. So the problem I've had with Lyme's is most people don't present with the characteristic fevers, headaches, muscle aches, rash. Most people present with just the chest pain, just the rash, just the joint pain, and it's really not presented characteristically most of the time. So it's really missed. A lot of people, when I tell them they have Lyme's, they're so alarmed because all they hear in the media is that it's chronic Lyme disease. If we were to pick up Lyme disease earlier, it's not a big problem. It's not a chronic disease. It would be an early disease that would be treated with antibiotics quickly within a week. Our third case is someone who presents with weight changes, fatigue, headaches, memory loss, depression, anxiety, stomach pains, joint pains, muscle aches. What do you think it is? It's celiac disease. Unfortunately, most people don't present with all those symptoms. They just present with one or more of those symptoms. We have to start testing for this disease more systematically and frequently. It has to be recommended for all patients with joint issues, infertility, kidney issues, depression, any other psychiatric diseases. A lot of people come to me and said, oh, I was tested for celiac and I was negative. But the only problem is you have to remember to get all 3 tests. So a lot of times people just come with one test that is negative out of the 3. Make sure that you get all 3 tests. The tissue transglutaminase, or known as TTG, the anti-gliadin, and the anti-endomycel. It's very important for you to advocate for yourself and tell the physician that you need all 3 types of blood tests, that one type of blood test is insufficient. I want to move on to another update on PCOS. So we've touched on it before, how to treat it with birth control pills and metformin. But I also do want to recommend, I recently had a person who improved greatly on cyclical progesterone. So 2 weeks on, 2 weeks off. Another person I know improved tremendously on the GLPs. So I'm not a big fan of the GLPs, but I have seen short-term use with really amazing outcomes. So if you're really stuck with the weight loss, the PCOS, the diabetes, I do recommend the GLPs being used. Unfortunately, there are tremendous side effects and poor outcomes with the use of GLPs. Please discuss with your doctor any known risks that GLPs can cause, such as blindness, thyroid cancer, and osteoporosis. These are very serious risk profiles, so please discuss with your doctor. Another diagnosis that research is shifting on is the MTHFR mutation. The MTHFR gene mutation is a genetic mutation that has been really under-recognized traditionally. It affects the way your body processes folate and other B vitamins. This can present a bunch of different ways: heart disease, blood clots, stroke, infertility, miscarriages, depression, anxiety, and other neuropsychiatric disorders. It really has not been acknowledged by traditional medicine and isn't utilized and tested as frequently as it should be. It is very easily treatable with folate and methylated folate treatments. And you can resolve conditions such as heart disease, seizures, neuropsychiatric diseases, and prevent infertility. Unfortunately, MTHFR mutations are really not discussed that frequently and are underutilized, undertested, and really should be recognized more prevalently and included in most diagnostic workups. Okay, we're going to talk about glutamate deficiency, which means it's low, is very similar in presentation to toxicity, which means the levels are high. Deficiency of glutamate looks like fatigue, insomnia, seizures, depression, anxiety, attention deficit. The best way to treat glutamate deficiency is through glutamine supplements. Then on the flip side, we can talk about toxicity. Toxicity can be easily treated with removal of gluten, soy, dairy, and the addition of magnesium and Namenda. Also, reducing your screen time can help. Before we close, I want to discuss an option of going to Quest Labs on your own. So frequently I give advice to people who then go to the doctor and want to get certain tests ordered, and the doctor refuses to do so. So I just wanted to inform the public that you can go to Quest on your own volition and order certain tests such as blood counts, hormonal levels for men and women, vitamin D levels. The only thing I just want to inform you is that if you get a B12 level and it's below 400, the more sensitive test is to check for elevated methylmalonic acid and homocysteine levels, which you cannot get at Quest. The other option also is if you want to get checked for Lyme's, the less sensitive Lyme test, ELISA, is only offered as well. So the Western blot test is not offered. If you want to get checked for celiac at Quest, you can only get the one out of the 3 blood tests that I am recommending. Only you can get the TTG. You cannot get the gliadin or the endomycel. So another medication that I want to touch on is Ivermectin, which we all know was used to treat COVID. It also is long-term has been able to treat rosacea as well, but it is emerging as a treatment for autoimmune disorders. Ivermectin as well, used in conjunction with mebendazole, has been shown to treat breast and prostate cancers and resolve or show regression in those cancers up to 50%, which is pretty efficacious. It's also been used to combat glioblastoma, thyroid cancers, lung, and GI cancers. So we've covered a lot today. We've discussed the importance of diet and exercise, getting your own blood test done, and reviewing these results with your doctor. Please leave any questions in the comments section, and I'll see you next time. That's it for today's episode of You Represent Science. If something we discussed resonated with you, if you have a story of your own, or if you have any questions you'd like explored on the show, I want to hear it. These stories and questions matter, and they deserve to be heard. Write to us at yourepresentsciencepodcast@gmail.com. Come find us in social media and keep the conversation going. All the links are in the description. Thanks for listening.